So I have my patient's MAR, and this is Miss Betty Crocker. She's allergic to codeine, patient Dr. Smith, and her blood sugar was 167. So I'm gonna go ahead and wash my hands and prepare my medication and do my first check. So I need to get Novolin N 20 units. So I'm gonna look at my med card, and I have my Novolin N, it's my cloudy. And then I need Humulin R, or regular, which is my clear. All right. So I need to get 20 units of Novolin N, and according to the sliding scale of 167, the patient will get 1 unit of regular. So I'm gonna give a total of 21 units, okay? So I inspect my valves. Both valves look normal. I don't see any clumpiness or any particles inside my valves. I also want to check for expiration. So my expiration date is within normal limits. Okay, so I'm gonna go ahead and roll my cloudy insulin. We'll never shake it. And then I need to clean off the tops of my valves with alcohol and let it dry. Okay. I need to pick which insulin syringe that would be appropriate for what I'm going to draw up. Okay. So since I'm drawing up 21 units, I will decide to use, I want to use a smaller needle. So let's go ahead and use my 100 unit syringe. So I'm going to use this syringe. Okay. All right. So I'm going to draw back 20 units of air. Actually, it's kind of blurry. Take my cap off, put it inside my pill cup. Inoculate my valve, my cloudy, and I'm going to push in 20 units of air. Okay. I also want to make sure that my needle does not touch the solution, because I do not want to accidentally mix what's inside this valve into my regular insulin. Okay. And then I'm going to pull back 1 unit of air for my R, and then inoculate my valve. Oops. And then now I'm going to draw up 1 unit of insulin. And because I am not going to mix this inside this valve, if I need to pull back a little bit more, I can, just to get rid of the air bubbles. So I have 1 unit, and I'm going to verify that with another nurse. So I have 1 unit of R. Okay. And if you need to get rid of the air bubble, you can flick it, or with this you can also go back to get your right dose. Okay. Now, next thing I need to do is draw up 20 units of my Novolin N. So I'm going to take my syringe to the 21. Okay, making sure I don't accidentally push back any insulin. I'm going to go slow till I get to 21. And I have 21. Okay. All right. So I got my insulin prepared. I'm going to go ahead and recap my needle, being safe not to accidentally stick myself. Okay. So again, I'm going to check my MAR. I have Novolin N and I have Novolin R that I have in my syringe. Okay. So now I'm going to go to my patient's bedside with my MAR. Hello, Mrs. Crocker. My name's Shonda. I'll be your nurse for today. I have your insulin for today, your scheduled insulin in the morning, and I have your as needed insulin for a blood sugar of 167. Could you tell me your name and date of birth? Okay. And then, do you have any allergies? Okay, so I'm going to clean my hands, provide for privacy. Mrs. Crocker, is there any place that you prefer for your insulin, or do you remember where the last nurse gave your insulin? Okay, and so the last nurse gave it in her arm. I'm gonna give it to her in her abdomen. Okay, so I verified. I got clean my hands again. Put on my gloves. And I also got me an alcohol swab. All right, Mrs. Crocker, I am going to raise your gown. I'll give you your insulin. Come on. Prep your skin. And let that dry. Okay, as it dries, bevel side up. I'm gonna go pinch the patient's skin, 90 degrees straight in, 1, 2, stick. With my finger not on the plunger, push it in, exhale, eject, okay? Do not rub the patient's skin, just let it conceal inside the subcutaneous tissue, okay? I'm gonna put this in my sharps. Get my patient back in order. Call out and reach, rails are up, clean up my mess, clean my hands again. Mrs. Crocker, do you need anything? No? Okay. And then I will document that I gave my 20 units of Novolin N and my regular of 1 unit according to sliding scale of 167, and sign my name and initial it. Thank you.